My diagnostic odyssey started with a lot of joint pain, a lot of tingling in my fingers, in my legs. Initially they thought I had a slip disc, which wasn't the case. And then it took 5 years to get a diagnosis. So I went to neurologists, rheumatologists, and they ruled out quite a lot of things quite quickly, but they weren't able to pin it down. And then eventually, by going to one particular consultant, they turned around and said, "This is what we think you've got." And it was purely by chance, because of good old Google, I was able to find out that there was a specialist actually at Adam Brooks in Cambridge. So I asked if I could go and see her and get some more information. And having spent some time with her, it was confirmed that that was what I did have, which was a massive relief because it was backwards and forwards to various hospital appointments. And it wasn't just relief to me, it was relief to my parents as well, because they'd obviously been on that journey with me. So I was put on the right medication, and now I am able to go into work. Work has been brilliant by adapting the workplace. I've been able to inform them about my condition, and I've also been able to join a support group in Cambridge, which has now started, and it's growing every time we meet up. So I think there's around about 20 of us now. What could have shortened the diagnostic time of 5 years is that patients, I think, are sometimes put into boxes of conditions, but if they looked at patients as individuals and treated everybody individually and holistically as well, because it was rather stressful and stress put on my symptoms, and they obviously increased, which meant more time off work. And when this was explained, they presumed it was then another condition that I was having symptoms of. So if I think patients are looked at as individuals and not tried to be placed into a box, I think that would be a lot better. The group is overseen by FND Dimensions, which is the overall group within the UK. And then the Cambridgeshire branch, it was a case of social media. We do have a Facebook group, so if we're having a rough day, we can go in there and we can say and have a bit of a rant if needs be, because they understand. But it is also a case of word of mouth as well. So people bring along their partners, other family members. I've taken my parents both at different times because different things have been discussed. And I think as a whole, because it's becoming more diagnosed and people are being more vocal about their condition, I think they think that they're alone. I thought, there's nobody really out there, but there are actually quite a lot of people out there with FND.